Welcome to today's bite-sized learning presentation on grief and loss in children and teens during COVID-19, brought to you by Alliant Health Solutions. My name is Sherry Creel, and I'm a licensed mental health counselor and quality advisor with Alliant Health Solutions. Alliant is a strategic partner in the National COVID-19 Resiliency Network. The National COVID-19 Resiliency Network is a national initiative designed to mitigate the impact of COVID-19 on populations disproportionately impacted by the pandemic. On December 7th, 2021, the U.S. Surgeon General, Dr. Vivek Murthy, issued an advisory on the youth mental health crisis that was further exposed by the COVID-19 pandemic. In this advisory, Dr. Murthy reported that the pandemic added to the pre-existing mental health challenges that America's youth are facing. The pandemic continues to disrupt the lives of children and adolescents. Some of these disruptions may include in person schooling, in person social opportunities with friends and mentors, limited access to healthcare and social services, and the health of their caregivers. With each change and disruption, a loss is experienced. In this presentation, I sit down with Dr. Pamela Banks, Department Chair and Professor of Psychology at Jackson State University, to discuss how grief and loss during the pandemic has impacted children's lives. Welcome, Dr. Banks. Before we begin, can you define grief for us?
Thank you, Sherry, for introducing me, and a special thanks to Alliant Health Solutions for an opportunity to disseminate information about grief and loss, especially during this pandemic. Loss and grief has occurred tremendously over the last 2.5, 3 years. When we think about a definition of grief and loss, we think of a process and a journey experienced when someone loses a loved one. Also, we think of grief and loss when there's loss of the individual in the role that they have played in our lives. With grief, of course, we think about the individual having passed away and no longer physically present with us. That brings us to a point of sadness, crying, regret, sometimes anger and frustration, beliefs that we can't go on without this loved one. And that belief and some of those other thoughts that we may have will result in us feeling a tremendous amount of psychological pain and deep, intense sadness.
Thank you, Dr. Banks, for that clear explanation. Could you tell me what situations would create feelings of grief and loss?
Persons have lost their parent, lost their child, siblings, close friends, best friends. The main statement we hear people make is how much they're going to miss the person. So the key situation is missing that loved one who is no longer with them.
I know that when a person experiences a loss, they go through stages. Can you tell us a little about the stages of grief?
Yes, Sherry. Elizabeth Kubler-Ross developed a notion of 5 stages of grief, beginning with denial, bargaining, anger, depression, and acceptance. And actually, Dr. Kubler-Ross stated that while they're called stages, they're not in any particular order. She also indicated that individuals may circle back to some of the stages. With the denial stage, an individual believes that this can't be happening. And I personally recall when my mother passed away, I continued to say, not my mother, not my mother. And that was an indication of a denial that this had happened. With the anger stage, individuals are making self statements such as, why is this happening to me? And of course, when any of us feel hurt, we are sometimes angry about that hurt and are saying, why is this happening to me. With bargaining, a lot of times the self statement that individuals make will be, I will do anything to change this. So children might say, I won't get in trouble at school anymore. Adults may say, I will be a better parent, I'll be a better spouse, a significant other. Bargaining in the sense of if this person is spared and this horrendous loss doesn't occur, I'm going to change the way I am, the way I've been. With the depression stage, a lot of times the self statement is, what's the point after all of this loss? What is the point of going on after this loss? And in the depression stage, individuals may feel deep sadness, excessive crying, feeling that their situation is helpless and hopeless, and then tremendous, intense feelings of missing their loved one. In the acceptance stage, which is considered kind of the final stage, because typically the self statement that the individual makes is, it's going to be okay. It's their belief that it's going to be okay. And with that, they accept that the reality of the loss of their loved one, and they understand that their situation is reality based, and they make decisions, conscious decisions, to try to adjust and to move forward with their lives.
Dr. Banks, I can imagine that grieving looks different with children and adults. Can you share with me how grief may be different for children?
Sherry, when I think about grief as expressed by children, I think about the child acting out in school or at home. I think about the child becoming more disobedient, talking back, being sassy. I think about the children having trouble with their normal routines, their play and their wanting to be with their parents are all affected. They're clingy. They are irritable on the playground. They're not sharing. They're easily frustrated, easily agitated. So that's how we see it oftentimes in children. Sometimes children also express guilt and feel that they're the blame. If they had been a better child, then maybe their parent, maybe they wouldn't be punished by the loss of their loved one.
Thank you for that explanation, Dr. Banks, because I think parents really struggle with their children, when going through grief and loss with them. When should you consider grief counseling for your child?
Grief counseling is recommended when some of those behaviors that I've listed interfere with the child's ability to function. And for a child, their functioning occurs in the home. So if they are so uh, disruptive at home and so upset, intensely upset, and they cannot have a healthy relationship within their family, then they may need to be referred for counseling. For the teenager, if they are engaging in a lot of risky behaviors, sensation seeking, getting in trouble with the law, and perhaps even substance use, then that's interference with functioning, and it is recommended that the parents seek additional help.
Besides formal grief counseling or formal counseling, what other types of resources are available for parents of children or teens who are supporting them through the grieving process?
Online, there are a multitude of resources, and what comes to mind are two: childrensgrief.org and childmind.org. These two resources offer activity sheets, they offer videos, and they offer instructions and tips, rather, for coping with grief that parents can implement to help their child manage and cope with this very difficult and painful life experience.
Dr. Banks, thank you so much for sharing those important resources. Lastly, are there things we can say or do for someone who is grieving?
It's very interesting that we always are compelled to say something. when someone experienced a loss and during their period of grief. But actually, I've discovered that just being there for the individual is sometimes the best response that you can give. They're not words that can be stated that would help reduce the psychological pain, but they are actions that speak louder than those words, whereby you are present, the parent is there with the child, the parent is helping the child to engage in some normal activities as they have a desire. The parent is modeling some behaviors that they want to see their child demonstrate. They're just not words or statements, but they're actions. It is so important for parents to allow the child to talk about the loss, but also to provide a safe and consistent environment for the child so that they can better adjust to the loss. As I said earlier, this is a process and it's not the same. There's not a one size fit all. People express their grief in different ways. Children express their grief in different ways. And so it's very important that people are adaptive and receptive to flexibility in how to help someone adjust. And sometimes we have to think outside of the box too.
Well, as we close out today, Dr. Banks, are there any final words or recommendations to someone who may be experiencing grief or loss during this difficult time of COVID-19?
Yes, there are a few things I'd like to state as take home messages. First of all, knowing that grief is a normal response to loss. It is a journey. It is a process. Is affected by the various stages of grief, but not necessarily in any particular order. And it is so important for parents to have a presence and a support for their children, for parents to engage in self care themselves, because the parents have to remain mentally healthy in order to care for their children. So it's very important that the parents seek additional help if they need it so that they can be able to care for their child who may be having an intense, difficult time with the loss. It is very important that the parents try to let their children be engaged with other children. And it's very important that the parents engage in whatever support systems they have available to them. It has been shown time and time again that one of the best remedies for depression is to seek out and obtain social support. And so, with that, I want to stress to adults that they do not withdraw from others, but rather make attempts to seek out and obtain support from others. And that's one of the first steps toward the road of recovery and acceptance after one has experienced grief and loss.
Thank you so much, Dr. Banks, for joining me today and sharing your knowledge and expertise with us. We truly appreciate you taking the time to provide us with some valuable information and resources.
You're more than welcome. Thank you for this opportunity.